Hey, everyone. It's so great to be here. I have so much respect for folks who work in the nonprofit sector. That's where I've spent a lot of my career. And I'm really excited to share with you today about a topic that's really important to me, turning feedback, audience feedback, into effective health communications. So let's dive in. Today, we're going to start with a little bit about me and why my background in health communications and nonprofit communications has driven me to build the platform I'll also be telling you a little bit about. We'll discuss why audience feedback matters and how you can effectively gather it. I'll be sharing a case study from Western North Carolina Health Communicators Collaborative, followed by a practical tool that you can use that I'm building called Arclet. And finally, we'll have time for Q&A. So feel free to jot down any questions that you have as I'm going. So a little bit about me. Jasmine did a great job introducing me, so I really appreciate that. As she mentioned, I've spent my whole career in nonprofit and health communications. I love it. I think it's such a beautiful, creative sector that can make such positive impact. And as I'll be talking about a little bit, I've gotten frustrated over the years that we don't have better tools to do a lot of this communications work. I've worked at places like the School Based Health Alliance, Bread for the City in Washington, D.C., the YWCA of Western North Carolina. And up until this June, I had worked for 6 years at Western North Carolina Health Network, which is a regional public health nonprofit that serves the Western region of the state of North Carolina. While I was there, I founded the WNC Health Communicators Collaborative, a regional collaborative, and I'll be telling you a little bit more about that. Um, and I have my LinkedIn on there. I love to connect with other communicators. So please feel free to look me up. So audience feedback and why it matters. The fact that you all are here today in this session tells me that you already understand the importance of engaging our intended audiences for their feedback on our communications efforts. But it doesn't hurt to walk through it together just as a reminder. So, first of all, tailored messages improve effectiveness. Audience feedback allows public health communicators to tailor messages that align with the values, beliefs, and needs of specific communities. And this, of course, increases the relevance and the impact of the messaging. It enhances trust and credibility. So, feedback, engaging community and incorporating their feedback can help build trust in public health initiatives. People are more likely to trust information when they feel that their voices have been heard. I think a lot of us understand that intuitively and just from the work that we've done in our communities. They're, they want to see that their experiences are reflected in communications, and that underscores too the importance of local communications. Lots of times, national, federal messaging, it's quite generic because it needs to try to reach everyone, and people may not see themselves reflected in that messaging. So how are we truly reflecting our communities? Audience feedback can help communicators identify if the messages are clear and easy to understand and culturally appropriate. And without audience input, health messages may be misinterpreted, ignored, and then in worst case scenarios, they can lead to some real harm if people are offended or turned off or confused by the information they're getting. Uh, Feedback and ongoing engagement keeps the audience involved in the health communication process, and this increases the likelihood of sustained behavior change. Active engagement helps reinforce the importance of public health messages and encourages community action. It supports continuous improvement. So, public health challenges are dynamic, and ongoing feedback allows for continuous refinement and adaptation of our health messages. I think this is so important and something that we're not always very good at doing, again, because we really lack a lot of the capacity and tools and bandwidth to do this. And finally, it encourages cultural relevance. So, audience feedback helps make sure that health messages are culturally sensitive and resonate with diverse populations. And this is particularly important when we're reaching communities that are historically and currently marginalized and underserved by our health system. So moving on, different ways to do it. How do we gather this critical feedback? There are several methods including surveys, focus groups, and listening sessions. So interviews, which I love doing, can provide in-depth insights, and they're also great at relationship building. And they take a lot of time. Um, Social media engagement allows you to connect with your audience where they're already active. Community advisory boards also can be a huge lift, but they can provide ongoing structured feedback and leadership and involvement. So I'm going to open up a poll right now if the team can help me. The first poll to see which of these methods you use most often. Is it possible to launch that poll? Great. So I would love your feedback here. So I've got that poll open. And if you don't currently use any of these methods, I want to say that is totally okay, and understandable. I understand how hard it is to prioritize collecting audience feedback because I've experienced this challenge so frequently in my work over the years. So it looks like surveys are popular. Um, those are great. We can use SurveyMonkey. We can use Google Forms. For my work in Western North Carolina, we've used Facebook polls on Facebook quite often to gauge whether audiences are seeing and liking our messaging that we're sharing and whether it's leading to any impact. And I'm seeing some of you are saying that you don't currently gather. So thank you so much for being open about that. And that's probably again why you're here today, to figure out, are there some ways that we can do this more easily? So with that, thank you for taking that poll. I want to jump in and talk a little bit about a case study for some of the work that I've been doing in Western North Carolina. So I first brought together the people who would become the Western North Carolina Health Communicators Collaborative. And if we can, I think we can pull down this poll now and go back to the slides, if you don't mind, because I'm sharing a pretty text-heavy slide right now where I'm showing off about our group in Western North Carolina. Thank you. All right, so the Western North Carolina Health Communicators Collaborative, we started in March 2019, bringing together health communicators from hospitals, health departments, and community organizations across Western North Carolina. And when I first brought this group together, obviously this was a year before the pandemic was happening. Um, I really did it because I saw that those of us in communications roles were often siloed at our organizations and lacked a lot of support and resources. So when we first came together, the group began as a peer network. In September of 2022, right at the beginning of the pandemic, as soon as we were able to raise the resources we needed, we launched a 3-month COVID communications pilot across 5 of our counties. And the success of that pilot led us to a regional campaign that we called My Reason WNC. And that ran from December 2020 through May 2022. So a really critical thing happened, though. I think it was about a year into the pandemic. In addition to leading this group in Western North Carolina, I was part of a statewide COVID communications task force, and was participating at the national level on these National Public Health Information Coalition (CDC) calls. And it was around then that I realized that the CDC did not even have the capacity to consistently pre-test a lot of their messages and materials that they were sharing with the American public. And it was at that moment that the realization hit that we couldn't assume that this messaging was going to be understood by our communities in Western North Carolina, and that it was really our responsibility to figure out, even with our limited capacity, how we could stand up audience feedback sessions. And so that's when, during the pandemic, we started doing Zoom listening sessions. We compensated people for their time. We recruited folks through our local partners, and those were critically important in helping us shape our messaging and make sure that people understood and it resonated with it. So our work, we took our learnings and our experience from COVID, And from March 2023 to June 2024, we ran the View from Here Western North Carolina campaign, and we focused on substance use, mental health, healthy eating, active living, and COVID and flu vaccines. So each of these areas was identified through local community health assessments as topics of need and interest in our communities. So right there we see, I don't know how many of you are familiar with community health assessments, but each county health department across the country does these community health assessments where they're gathering data on health priorities. They're ideally engaging community and helping prioritize which topics are most important to address. And then together they're identifying what are we going to do about it? What are the initiatives we're going to undertake over the next few years to try to turn the curve on some of these huge health topics. So right there, you can see how our health messaging campaigns that we did were guided by community feedback. And I think that's a key point that we don't have to do it all on our own. Let's partner with each other. So if you're at a community-based organization, reach out to your local health department and see how you can engage and work with them. That's a little bit of a side point. So through our campaign, we used local storytellers to create ads that were then branded and amplified within each county via social media platforms. And so this helped us ensure both the relevance of the messaging and our messengers, and that they would hopefully lead to some actions and behavior change. So these are some examples of some of the ads that we created through the View from Here campaign. As you can see, we used real people from the communities that we were prioritizing, and this helped us make the messages more relatable and trustworthy and high impact. These visuals were refined based on feedback loops that included community input and ongoing evaluation of their effectiveness. So how did we gather feedback for these campaigns? We used several methods. And again, I want to stress that we didn't have a ton of resources to do this work. So it is possible, and it's hard. And a lot of it comes down to just the people power that it takes to gather this kind of feedback. So we advisory groups, we had our regional communicators group, and then we had a stigma advisory group, and those groups provided ongoing input. We also, as I mentioned, held listening sessions over Zoom with people's lived experience and local subject matter experts to ensure our messages were on point. And we had continuous evaluation of social media metrics that allowed us to see, were our messages resonating with what people wanted to see, and what kinds of comments were we getting. So social media comments are really rich, sometimes overwhelming, but very rich area for gathering community feedback. And we use surveys through tools like SurveyMonkey to gather feedback on draft campaign assets. And that sounds like something that you all have a lot of experience with. And this was, again, I just want to say it was a lot of work. I'm still exhausted when I think about it. But this slide I'm showing here is just, I think, to me, underscores why it's such a beautiful and rich area to get this kind of feedback. So this image that I'm sharing, these are the key themes that came from the listening sessions that we held within all of the counties in our region as we were forming our View from Here campaign. And what we heard from people around what they thought would make a successful health communications campaign were things like they wanted to center and celebrate our region. They wanted to evoke feelings of strength and resilience, to address stigma, to connect audiences with resources. They wanted to highlight local personal stories. So we really used this audience feedback and input to shape the North Star of how we did our communications work. And it's why I think we were ultimately quite successful in the campaign that we did. So all while I was doing this work in Western North Carolina, I was getting increasingly frustrated that we didn't have better tools to do this important work, including collecting audience feedback. And after years of thinking and talking and kind of developing proof of concepts for how we could do this work more effectively, finally in 2023, I received this Information Futures Fellowship at Brown School of Public Health that gave me 6 months to explore an idea for a health communications platform that I'd had for many years. And as part of that, I did some primary market research. And one of the questions I asked state and local health departments was about how they pre-tested their health messaging. And as you can see, only about half of the respondents said that they pre-tested their health messaging. And when we dug deeper, what we found is that pre-testing, when they said they were pre-testing, this was often assumed like, oh, we're using messages that have already been pre-tested. But what we already learned during COVID, as I mentioned, was that, even like the CDC isn't always pre-testing their material. So I think lots of times we think that's happening and we can't always trust that that's happening. We also found that even though they said they were doing some pre-testing, that sometimes it was just with their colleagues, or it was very sporadic and it was dependent on when they had the grant funding to be able to do it. So I would love to open up another poll real quick and just get a sense from you all about some of the biggest challenges that you face with testing or gathering feedback on your messaging. So if you want to just take a minute to respond to this poll, some of the challenges I captured here are, and these are ones that I've experienced in my career and ones that I've um, heard from my peers in my region and my state and across the country. Challenges can include reaching the right people, low response rates, limited resources to do this work, the ability to analyze and apply the feedback, or there might be others. So also chat if another big challenge comes to mind. So I'm looking at responses. I'm seeing, and this is not surprising to me. One of the biggest challenges I'm seeing in the poll is limited resources, the time, the budget, the staff to be able to consistently get audience feedback. And then I'm also seeing low response rates. And that makes sense. So how are we engaging folks and getting their feedback? And sometimes it feels like when we're trying to do this work of getting feedback and people don't respond, it can feel really discouraging. So I've been there too. And I wonder if there's something there around how our ability to do that work consistently, and perhaps our ability to incentivize and reward people sharing their feedback with us. Okay, great. Thank you so much for that input. That's very helpful to see what the biggest challenges you are facing. So I want to just underscore these challenges that you all named in getting feedback. They're not unique to you. So I don't want anyone to feel discouraged. And again, I know I have at times because we know what we want to be able to do, and it's hard when we feel like I know how I wanted to be able to do my job, and it's hard for me to be able to do this. So again, that's what has really led me to do what I've been working on for the past year and a half now, which is building a national platform to support health communicators. And this platform is called Arclet, and Arclet's the small arc of a galaxy. And to me, this is something that conveys something that feels very simple up close, but is actually part of something huge and transformative. And that's what I feel like this tool has the power to do. This tool supports local communicators, whether you're at a nonprofit organization, a foundation, a public health agency, a hospital, a federal agency, in finding, customizing, sharing, and measuring health information in your communities. So I don't have time to do a demo, but part of what I would love to extend the offer right now is for any of you who want to see in the platform to please reach out to me, and I'd love to get you access into the platform. So this is I'm going to show you some views of what we can do though. So first of all, one of the ways that we can streamline health communications is by using existing evidence-based materials and assets. So Arclet's locate feature curates resources, making it easier for communicators to access and validate and adapt validated content. So this not only saves time, but also ensures that your messages are rooted in best practices. And then users can go a step further and not just take and use these materials as we're being given them, but also within the platform are able to adapt and customize the messaging and assets so that it reflects your organization and the community that you're trying to reach. So again, this is coming from my direct lived experience supporting communicators in Western North Carolina, where being in a rural mountainous region, a lot of the times we're seeing health assets that look very urban. They look, they've got skyscrapers in the images. The language doesn't reflect our community. So that's really what motivated me to want to be able to want each community to put their own local flavor on these health messages to ensure to increase the likelihood that they'll resonate with your audience. So then and this is the part I'm really excited to show you, but this is the feedback feature in Arclet. Eventually, we'll be able to do more things like A/B testing with a small percentage of our target audience. But for now, what we can do is gather feedback directly on draft campaigns from your intended audiences or subject matter experts. So this feedback supports you in refining your message and creative so that they're more likely to resonate when they're launched. And so this is another view from the Arclet platform of how you can create a reviewer group, shoot them a message. They don't have to have an Arclet login to be able to see what you're working on and leave their comments in real time. Something I really wish I'd had when I was working with the Stigma Advisory Group on our campaign in Western North Carolina. And then with an Arclet, I wanted to make it easier to not just find and adapt these messaging, but really support us as local communicators and how we're sharing them over social media platforms, because we know that's where a lot of our audiences are. And even where I live in Western North Carolina, where we have limited broadband access, we know that people are on Facebook, even if it's on their phone, in their car, in the parking lot of their library. So we need, as communicators, we need to be in these spaces. And that's critically important. And then finally, and the platform, we have a dashboard of our active campaigns. And this is critical audience feedback as well. If people aren't engaging with messaging that we're sharing, if they're not commenting, if they're not liking and they're not sharing, what does that say about how effective our health messaging is? That important that this information isn't to make us feel lesser than or to feel like we're not doing a good job. It's to help us put our time and resources towards what works and what works to do better, and to build a community of practice around that as a country. Can you tell this makes me really excited? This is why I'm doing it. So, in summary, Arclet allows us to gather and use audience feedback in the following ways: creating and engaging with reviewer groups, sharing draft assets and messaging for feedback, and then sharing those finalized assets with your partners for them to be able to use and amplify. So you're not just saying, "What do you think?" You're also saying, "Here, use this. Let's work together to share these important messages." Tracking impact in the dashboard. And then I'd love to hear what other ideas you have. This tool is designed by health communicators for health communicators. So I'm eager to hear your ideas for how we can build out the platform to support you. So now I think I've shared everything that I want to share right now, although I'll be in the um, salon or whatever it's
The
called.
lounge. Yeah, you're
The
going to be in the
lounge.
lounge to give some Q&A. But thank you, Adrienne. That was amazing.
Oh,
And I'm so sorry. I was saying Arclet, but Arclet
that's
is your
okay.
organization. Yes. Well, thank you so much for giving us all of your insights. Of course, people can join you in the lounge to get their